So then we're gonna do hip extension. The fulcrum is still gonna be that greater trochanter, and the stationary arm is still gonna be that midline of the pelvis towards that lateral femoral epicondyle. This one, there is definitely a lot of discrepancy as far as what the normative values are. I think AAOS says 30 degrees. I rarely see 30 degrees of hip extension. I think the videos and some of your other materials say 10 degrees, and that's much more typical of what you'll find. So if you tell us that normal is 30 degrees based on AAOS, we understand, you'll get the point, but just know that it's not common to see that much hip extension.
Just say 10.
Just say 10. This one you do not want to let the knee bend, and why would that be? No.
Your quads.
Yeah, if I bend her knee, I'm putting that rec fem on tight. I'm tightening the rec fem, so that could be the limiting factor. So you do want to make sure the knee stays extended for this one. I'm going to stabilize that posterior pelvis, bringing her up. Any pain? No. This one, if you want to ask the patient to help, like hand back, hold the Goni, that's fine too. So she felt like she was 15 degrees, firm and feel. So I'm going to preset my Goni. I'm going to say, I'm finding that greater troch. I'm going to say, patient, can you please hold that there? Totally fine. We get it. It's a big muscle or a big appendage. Try and move around. Just relax. Firm and feel, making sure I'm not getting a whole lot of excessive anterior pelvic tilt. And then I'm gonna adjust from there. She's at 12.
Sorry, where was the stationary arm?
Midline. Oh, sorry. It could be midline of the pelvis, but it was midline of the pelvis. I just had the arm this way for the numbers for my sake. It was easier to read.
Okay.
But it could be like this.
Oh, okay.
Does that make sense?
Yeah.
And then just make sure with your stabilization, I know I talked to some of you with preventing anterior tilt from the back. Although her hand is like this, she's not
Pushing.
You would be pushing them more into anterior tilt, which we have seen people do. So her force is through her thenar, preventing anterior tilt.
And my fingers are actually wrapped around on that ASIS to feel for that too. If that makes sense. So with this one, you might not be able to prevent the motion as much as feeling when you start to notice that. Okay, then also in prone, you can do hip internal and external rotation. So the one thing you might want to do in this case, do we have to account for the hip flexion? Like bring them up, or just you're fine with this?
I would maybe do a towel
under the knee. Okay. So in this position, just because there is a little bit of a natural hip flexion there, you do want to put the towel roll under the knee so that it's kind of more in line with the pelvis. Does that make sense? Can you lift that? More.
What was the moving arm for the hip extension again? Moving arm?
Lateral femoral, line of the lateral femur down towards the lateral femoral epicondyle. So then for prone hip internal external rotation, normative values are 45 for both internal and external, so that should be an easy one to remember. Your stationary arm is going to be perpendicular to the ground or a ceiling, which again, whichever one you want to think of. Your moving arm is going to be along this tibial ridge, and fulcrum is going to be the patella. Patella is going to be kind of underneath, but essentially where that patella is. You're going to stabilize again at the pelvis, making sure you're not getting a whole bunch of pelvic rotation. The movement's coming straight from the hip. So I'm stabilizing that posterior pelvis, coming over until I start to feel firm and feel slight over pressure and pain there. Then I can let go there, look. She looks like she's about 25 degrees. So I'm going to preset my Goni. Come back. that's where I'm gonna make my adjustments, and she's 22. So that's, is this internal or external?
External.
Why is this external?
Because
Because if I straighten her leg, her toes are actually pointed out.
Yeah.
So remember, if you're doing it with hip internal external rotation, when the knee's bent, it actually looks opposite of the direction you want to go. So then to do internal rotation, same stabilization, same moving arm, stationary arm, et cetera, et cetera. I'm just bringing her hip out to the side. She looks like she has way more here. That looks like she's about 50 degrees. So then I could preset my Goni, come back, stabilize. Any pain? This will also be firm and feel if I didn't say that. And she's at 48. Good? Okay, can you sit up facing